In this video, we are going to discuss some of the common questions asked after someone decides to get vaccinated. We talked in a previous video about side effects that can occur after vaccination. The most common side effect is injection site pain, redness, or swelling. So if you experience this, there are a couple things you can do. One is to apply ice to your arm. And the other thing you can do for this injection site soreness is to make sure that you keep moving your arm and exercising your arm. Sometimes when we feel muscle soreness, we tend to keep that arm still, but this can actually increase the soreness. So you want to make sure you're moving your arm around. The second kind of side effects that we talked about previously are things like headaches, fever, chills, and muscle pain. These are all normal signs that your immune system is building protection, but they can be uncomfortable. You can treat these symptoms with over-the-counter medication just that you would normally take, like Tylenol or ibuprofen. Be sure to talk to your provider if you have any questions about taking over-the-counter medications, and call your provider if the symptoms last longer than 2 days or if they continue to worsen 24 hours after your dose. Knowing that these side effects can occur, people have asked about taking Tylenol or ibuprofen before getting an injection. There has been some research on other vaccinations that have found that pre-medicating can cause a decreased immune response, but there has not been research on the impact of pre-medicating before getting the COVID vaccine. Because of this, the CDC does not recommend taking anything prophylactically before the injection, but if symptoms arise, it is absolutely appropriate to treat with over-the-counter medications as needed. Especially for people who might have had some of these side effects after the first injection, there is the question, do I really need to get a second shot? The short answer is yes, unless you had an allergic reaction or there's some reason that your provider told you not to get a second shot. There are many vaccine regimens that require a series of injections, for example, the HPV vaccine or the hepatitis B vaccine series. As this graph shows, the first injection provides some immune response, but then that second injection provides a much larger immune response. The Pfizer trial did look at the efficacy of reducing COVID risk between shot 1 and 2 and found between a 30 and 68% efficacy rate. Similarly, data from 200,000 people in Israel was examined, and they reported a 33% reduction in COVID rates between days 14 and 18 after the first shot and before the second shot. So there is some protection after the first shot, but you don't reach that full 94 to 95% efficacy rate until after the second injection. So how long after your vaccines will you be protected? This is a great question. We looked at this graph before, and it shows the incidence of symptomatic COVID infection over time. The red curve is the group that received the placebo, and the blue curve is the group that received the vaccine. And we're going to zoom in on this part of the graph in the first few days after dose 1. Your body begins to have immunity at about day 12 after the first shot. That's the point on this graph when the red line keeps increasing, meaning the placebo group continues getting COVID-19. But the blue line begins flattening, and so people in the vaccinated group are not getting infections at the same rate as the placebo group. Studies have found that full immunity and that 94 to 95% efficacy is reached at about 7 days after the second dose. Another common question is, once it's been a week or two after your second dose, can you stop doing all these mitigation practices? And unfortunately, the answer to that is, for now, we need to keep practicing safety measures like social distancing, limiting gatherings, and wearing masks. One specific question we got was whether people had to stay away from family members who were immunocompromised after getting the vaccine. Remember, the COVID vaccines that are currently approved don't contain live viruses, so you can't infect someone because you had the vaccine. In an earlier video, we talked about how the vaccine greatly reduces your risk of getting sick from COVID, but that studies didn't look at whether the vaccine decreases asymptomatic COVID or the ability to spread COVID. Preliminary data does look like the vaccine decreases some asymptomatic COVID and some COVID spread, but until we know how much and have more data on this, we'll need to keep wearing masks, especially around unvaccinated people. Vaccination is a great tool to decrease your risk of getting sick from COVID and to eventually end this pandemic. However, until enough of the population is immunized and COVID-19 is much lower in our community, we still need to practice mitigation practices.